Hello everyone, good morning. Nice drizzling out here in Dubai. Look at the weather, it's beautiful. Anyway, uh, almost 2 months left for your exam, not more than that. And the things that you should be focusing on right now is you should have finished your therapeutic guidelines revision at least 3 times by now, at least 2 times Odell, and now you should be totally focused on solving the mock test and getting the correct answers as much as you can. See, what is the most common mistake that you guys are doing that I feel, because I have like around 50 to 60 candidates under me, and most of them who are sending me the questions to get the correct answers, they know the question, they know all the options, yet they get confused with their answers, and I'm wondering why. So for example, like this today morning, they sent me, one of the candidates sent me a question which is a simple question, and I'm sure you must all be going through the same scenario. So I thought I'll just give my little piece of advice. Don't be focused on jumping to the answer. If you have 1.5 minutes for the question, devote 1 minute to read the question. The rest 50 seconds you read the option, and because you have read the question properly, you'll immediately know the moment you come to that option which is the answer. So I'll give you an example. See, say 32-year-old came with a big swelling on his cheek and the lip because of a non-vital tooth, and he's in pain, and you have to provide him treatment. So this is a scenario. Okay, they can elaborate the scenario also by adding 2 3 other things to it, making like a big paragraph. This is a big scenario to divert your attention. Their main question would come in the last line, and that would be, what would be your initial management? So what you'll do is you'll read that entire question and you'll be reading what is your management. You don't read the keyword as the initial, because the options would be all the management options and they'll all be correct. So the options would be incision and drainage and antibiotics. Then it would be oral antibiotics and call the patient later, and do the RCT. Then complete proper debridement or refer to a specialist. See, all of these options are correct in their way. But what is the question asking you? What was the keyword here? What is the initial management? When they ask you the initial management, you have to answer incision, drainage, and antibiotics. If you start to think, why can't I just prescribe antibiotic and let the acute phase subside and then do the RCT? That is not the initial phase of management according to ADC, which is clearly mentioned in therapeutic guidelines, and you have to drain the pus and give the antibiotics. If the question would have asked you what is the definitive management plan for this, then my answer would have been complete debridement of the RCT space. But what did the question ask? Initial management. So here you know this scenario. You have been through this scenario in your clinical practice. You know the answer. So what mistake you did, you're not reading the question properly. You're not analyzing the question properly, which is what you're supposed to do. Understood? So my only advice would be at this moment is, you know your concepts, you know your knowledge now. All you need to do is start getting the right answers. And this will come by practice. Don't expect you to read one question and to answer it correctly and then get frustrated if the answer is not wrong. No, you're not mugging up anything. You understand why did you mark that answer wrong when you knew the answer. That means some keyword you missed in the question. So train your brain now to read the question properly and analyze it. Don't think that, oh, I have to solve this question fast because I have the rest 69 questions waiting for me. No, I rather that you mark 50 questions properly in the correct manner, 10 questions haphazardly, and if time does not permit, leave the rest of the 10 questions. It's okay. instead of marking 30-40 wrong answers and just getting 20 correct and then wondering why didn't I pass. You understand? The idea here is not to solve everything, which you will eventually once you start practicing properly, but focus right now on solving the correct answer. Right now, there is no deadline, so might as well train your brain to read the question properly. I hope this is clear. I'll go back to my practice. It's a long day, so have a nice day. Bye bye.